pelvic floor dysfunction. What is pelvic floor dysfunction and how to know if you have it is the subject of this video. In this video, I'll explain to you why when it comes to pelvic floor dysfunction, it is so important for you to not focus on just the floor of the pelvis, because there's more to the dysfunction than just the floor, and then tell you some of the subtle signs of pelvic floor dysfunction that you may be having right now without realizing it's related to your pelvic floor dysfunction. I will then tell you some of the things I do with my patients that produce the results that you may be after. So stick around for the very end, and if you have not subscribed to the channel, this is a great opportunity to do so, because I pack my channel with all questions relevant to pelvic floor dysfunction that you most likely may have right now. So let's begin. What is pelvic floor dysfunction? So pelvic floor dysfunction in general is instability of the pelvis, showing its manifestation in what resides in the pelvis itself and what is connected to the pelvis, therefore impacts its instability. So let me explain. Here's your pelvis, and you have your spine related or connected to the top, and you have your lower extremities connected at the bottom. You can see the hip socket right here. Inside of your pelvis, there are muscles, as you see. At the very bottom is what's referred to the floor, and you can see the walls of the pelvis are also covered by muscles. So where the floor ends and the muscles of the walls begin is not clear. It's not like the floor is suspended in the air. The function of these muscles is to work with the outside to stabilize the pelvis. So you've got double layering of muscles for stability. So when the stability is compromised, the foundation to this structure above is compromised, and you are this structure. Without your upper or lower extremities, you're not going to die. Without this structure, that's impossible to live. So the muscles inside the pelvis will change their behavior as a result of what's happening or not happening enough on the outside. Naturally, what we do to condition these muscles is through biological breathing. If you don't know what biological breathing is, I'll make sure we put it at the end of this video, but make sure you subscribe to the channel, because that's where I add 1 or 2 videos a week, and you get to actually keep up with the information. So when you breathe in biologically, you relax these muscles inside your pelvis, and when you breathe out, it's the contraction of these muscles that work symmetrically and in sync with each other to allow the process of expiration or exhalation. So every breath conditions the muscles inside your pelvis, and imagine if every breath does that, then it's extremely important for these muscles to be strong and to be having a good tone. At a frequency of every breath, nature assures that. So when you don't breathe biologically, you are compromising the integrity of these and the integrity of the stability of your pelvis and the structure above. So pelvic floor dysfunction is not just about the floor. And frankly, if the approach is only through internal work with the index finger, how far do you think that's gonna go? And why is it that that's the approach? How does nature do this is the question we need to ask, and see how we can reintroduce the environment that we have lost. Is it possible? And the answer is 100% yes. Is it possible to not have full recovery? Yes, and it depends. But going with the mindset of, well, it's never going to be 100%, therefore why bother, is definitely not going to get you where you want to be. So pelvic floor dysfunction, Now, as I mentioned, it also has different manifestation. It can impact the internal organs that reside inside the pelvis. So as these muscles get tight or they get weak and they lose their tonicity, the integrity of the size of this and the amount of compression on the internal organs inside the pelvis changes. So you have the bladder at the very beginning, then there is prostate or uterus in the middle, and ovaries of course on the sides, and then the intestine is all the way in the back. Depending on how this pelvis ends up being, if it's not leveled, it can tilt forward or be anterior pelvis, or it can tilt backward and be posterior pelvis. So neither one of those are stable pelvis. And so if it can, depending on the presentation, and no one, by the way, ever stays only in anterior, there is a shift to the posterior, anterior, posterior, but never or hardly ever right in the middle, or at least stays in the middle. So now if you have compression over the internal organs like your bladder, you're going to have bladder related symptoms. If it's over your prostate, it could be prostate related issues. They call it prostatitis. Or you can have it over intestine and have complications with bowel movement, which is very common, by the way. So those are the symptoms that most people, when it comes to bladder, they're like, oh, that's pelvic floor. But the other ones, they don't necessarily think that. But then you can also irritate the nerves that go through here. You have your pudendal nerve that can have manifestations related to pelvic floor dysfunction. You can have obturator nerve, sciatic nerve. There are issues that are related to the nerve irritation. You can have blood flow issue as a result of dysfunction in the stability of your pelvis. We're talking about pelvic congestion. We're talking about the veins that go, the blood vessels that go. We're heavily vascularized in the pelvic area, and when there is an irritation over that, the blood flow is compromised, and there is that congestion of the pelvis that exists. Now, these are the different things that you may or may not know related to your pelvis. But if you have chronic lower back pain, if you have chronic sacroiliac joint pain or SI joint pain, if you have chronic pubic bone issues or hip mobility issues or lower extremity issues, if you have poor posture, if your breathing is not biological, you have pelvic floor dysfunction. What I see in real life, in practice, is that people walk in because they have an incurable pelvic floor issue, or no one else seems to be helping them, or maybe they're not getting the result that they are after, and that's because the pelvic stability was not addressed. We can go after, let's say, your enlarged prostate or inflamed prostate, but why is it inflamed? That's the question we want to ask. The problem I see in the approach is that we don't chase the whys behind our symptoms, and so we end up trying 20 million things and we're still in the same boat. So what's the first step? The first step is to get proper diagnosis. I'm not talking about pelvic floor dysfunction. I'm talking about what is causing the instability. We need to look at things from biomechanical perspective. We need to see, why are these muscles tight? Why are they weak? Why are they impacting the internal organs? We need to look at the history. Do you have chronic lower back pain or SI joint pain or hip mobility pain or groin pain? If you have those, you have pelvic floor dysfunction. You may not have manifestations in your bladder, your prostate or uterus, or your intestine. It's just a matter of time. So it's much easier to address it now than to do it later. So you start with biological breathing, which we put at the end of this video. Once again, if you haven't subscribed, please make sure you do. Also, I would love to get your comments and your likes or dislikes buttons so I can see, basically get a feedback from you. The next step is following what is referred to as developmental exercises. Developmental exercises are the same exact things that every single one of us, walking human beings, start with. So we start as helpless infants, barely holding our necks up, to become running toddlers where our parents chase after us. No bands, no weights, no gyms, no guidance, nothing. And every single one of us on the planet Earth, regardless of all many differences that we have, we go through those same stages of development. That is the manual of movement. So if I compare you to that, I can see where the problem lies and how to stabilize. Honestly, it's that simple. So my suggestion is to educate yourself and to seek the right provider. So you educate yourself to see how to maintain what you learn from that provider. And of course, not every provider has the time or wants to share the knowledge. Thankfully, that's not me, and I enjoy teaching people so they can move on with their lives, so they don't have to keep coming to me for the rest of their lives. At any rate, I hope that you enjoyed this video, you found this helpful. Please send me your comments or any suggestions for any other videos, and make sure you subscribe. Until next time, take care.